What would you do as a psychologist if we sent somebody to you right after the surgery? What would be your role when a man is recovering from any treatment or intervention for their prostate?
I think this is wonderful what I just heard too, because over the years we've seen a lot. Another area we deal with is addictions, and in the or I deal with an alcoholism, for example, and getting into recovery. The old rule used to be that the recovering alcoholic didn't deal with the marriage or the relationship until at least a year afterwards. What we found over a number of years is by the time psychologists or treatment facilities dealt with it, a divorce was in process already. That there has to be addressing some of this issue, the sexual issue, as well as the relationship issues, which go into the recovery from the surgery, let's say, almost immediately. So one of the things we see oftentimes is within a couple of weeks to start to deal with the relationship qualities. One of the things early on that's dealt with is the sensual focus, the sensate focus, the quality of the relationship, being close, enjoying the moment. One of the things I'll often say to couples, and they enjoy this, is to eroticize the relationship in ways and terms that the couple's comfortable with. It was many years ago, this is way back in the 70s now, when I was working with Masters and Johnson for a short period of time. An 80-year-old gal came in to see Dr. Masters. And you know, there was one-way vision mirrors, and so there were some of us were observing it. And she said, look, I've just met a new man, it had nothing to do with prostate surgery, and he's asking me to do some things I've never done before in my 60-year marriage. And she said, what should I do? And he looked at her, he said, look, you're 80 years old, what do you got to lose? Giving her permission to go ahead and try to focus more on just the sensual nature of the relationship between the couple. So that starts very early, and then over a period of several weeks, there are homework assignments that they can do that helps develop the sensual focus and and the building and the strengthening of the relationship.
I'm having the epiphany right now. I mean, I'm just like, for the first time in my career, I'm having this one moment where I'm thinking, this is an absolutely fantastic role for a psychologist as part of the recovery process, because it would actually help bring everything together. And I don't know about you, but...
No, I feel the same way. I was like, why don't incorporate the psychological aspects in the penile rehab program? We're so focused on the medicine or the function that obviously there is changes going on that are beyond the function, and the changes that will probably help the couple or the relationship adapt better and enhance the recovery process.